Today our topic of discussion would be pharyngitis. It is of two types, acute and chronic. In acute pharyngitis, there are different causes. The most common cause is viral. It can be bacterial, fungal, or protozoal, right? And the clinical features are of different severity. In milder form, there is no lymphadenopathy. In moderate and severe form, there is enlargement of tonsils. And in very severe form, there is enlargement of cervical nodes. These are the things that you just have to remember. The diagnosis is made on the basis of the culture, right? If there is bacterial growth, this is the bacterial pharyngitis. And if the culture shows no growth, then this is the viral pharyngitis, right? In case of the viral, this is the most common cause, right? So what is the treatment? Because pharyngitis is something that I think everyone or almost a lot of people have experienced, right? So the treatment is based on the culture, right? That is a medical treatment, which is specific. But a general treatment, the general measures for a patient with pharyngitis are bed rest, plenty of fluids, saline gargles, and pharyngeal irrigations and analgesics. For example, if it is very severe and a patient is excessively in agony and he or she cannot swallow even his saliva, then during the meals or before meals, we give that particular person lignocaine viscous because this is a topical anesthetic and it decreases the pain. The specific treatment is based on the culture. If it is bacterial, in case of the streptococcal pharyngitis, penicillin is given, and those who are allergic to it, erythromycin is given. In diphtheria antitoxin is given. Penicillin or erythromycin is also given. In gonococcal pharyngitis, penicillin or tetracycline is given. The viral infections that cause pharyngitis are Herpesingina and the infectious mononucleosis, cytomegalovirus, pharyngoconjunctival fever, acute lymphonodular pharyngitis, measles, and chickenpox. That is just a read. That is not that much important. You just have to remember the clinical features, how the diagnosis is made on the basis of culture, what general treatment and what specific treatment is given. In case of fungal, the candida is the cause, the whitish layer is formed, and nystatin or itraconazole is the treatment. Miscellaneous causes are chlamydia and toxoplasma. The chronic pharyngitis is very important. Now, acute can convert into chronic pharyngitis. So how is it characterized? We see that there is hypertrophy of the mucosa, seromucinous gland, lymphoid follicles, and even the muscular coat of the pharynx. This is just a definition. At this particular moment, you won't be able to understand. With the passage of time, you'll be understanding it. It is of two types, chronic catarrhal pharyngitis and the hypertrophic granular pharyngitis. The cause of chronic pharyngitis is persistent infection in the surrounding structures, or the patient is a mouth breather, because when we do nasal breathing, the air is filtered, but when we do mouth breathing, the air directly goes without filtration into the oropharynx, and it can lead to pharyngitis. And the chronic irritants, those who excessively smoke, drink, it can also be the cause. Environmental pollution and the faulty voice production in certain professionals who are excessively using, I guess, their vocal cords, they're also having a problem, right? Symptoms are discomfort or pain in the throat, foreign body sensation. The person is having a desire to just get rid of that particular foreign body, and the person is unable to speak or he is tired of speaking, and cough is also occurring. The signs that we see are based on the two different types. If it is the chronic catarrhal pharyngitis, there is congestion, there will be edema, there will be dilation of vessels, right? And the pillars, which are actually, they are thickened. And in case of the chronic hypertrophic granular pharyngitis, as the word is suggesting, it is granular. As you can see in this particular patient, and in the posterior aspect, there are some nodules, reddish nodules. This is a characteristic sign of the hypertrophic granular pharyngitis. The congested mucosa, dilated vessels, studded with the reddish nodule. This is important. And the lymph nodes are also enlarged, and the uvula can be elongated and appear edematous. In this particular aspect, the uvula is edematous. Treatment is, first of all, you have to find the reason. Then warm saline gargles and voice rest and speech therapy and cautery of the lymphoid granules is suggested, right? And the next topic is atrophic pharyngitis. It is seen in those who are having atrophic rhinitis, right? What is the characteristic? That the mucosal gland of the pharynx is atrophied, right? And it is producing scanty amount of mucus, and when it gets infected, it leads to foul smell. right? The clinical features are dryness and discomfort, hawking and dry cough may be present. This is just a read, and treatment is based on the pharyngeal irrigation, spraying the throat with alkaline solution and potassium iodide, right? Keratosis pharyngeis. This is important just for MCQ point, that this clinical presentation, whenever it comes, these horny whitish structures in the pharyngeal wall, posterior pharyngeal wall, or the tonsillar area, whitish or yellowish dots, they indicate keratosis pharyngeis. So this is it. Hope you understand.